Hi everyone, I'm Paul Lobaz. I'm a GP currently working at Unsworth Medical Centre in Bury. I'm also the GP educational lead for Bury Hive, which is run by the Bury Federation, with responsibilities of undertaking and arranging teaching and professional development for our GPs and our frontline clinicians. When we first heard about the Unified Learning Environment, or the ULEs, we were firstly quite curious about what that would mean. As a practice, we've been keen to get involved with the education and supervision of trainees and students. Even when I started at the practice, that was already occurring. So, for example, we take regularly GP trainees. We also take students from the University of Manchester. And we've also recently been involved with the additional roles scheme, so the R's roles through paramedics who have undertaken supervision with us. The curiosity came when we discussed with our manager about what does it mean to be a ULE and how will that change what we do already. We approached Greater Manchester Training Hub to find out what that would mean for us, and we were really pleased to understand about the additional opportunities for training that it would provide for us, and also the additional support that they would also provide, which would make us more effective. So we were very keen to get involved with starting the application to become a unified learning environment. The actual completion of the audit as well is, again, if it's shared amongst members of the team, certain members of the team can answer certain parts or fill other parts in. We found that actually then the getting this document together was relatively straightforward and didn't take nearly as much time as we thought. We know from experience some practices have taken longer because it's just taken a bit longer to gather the evidence. But we know that for some practices who really want to progress, they can get this done within a few weeks. So there's lots of flexibility with that. And also the GM Training Hub will always give you that support to complete that and support you if say the time duration to complete it is take a bit longer. Being a unified learning environment provides many benefits. I think primarily we think about the benefits to our staff members. So as a partnership, we've all had a keen interest in education. We find it's really useful to help enrich our work patterns, and we feel as partners and as GPs, it makes it kind of coming to work really important. It's something that we really enjoy doing. We love to see learners and trainees having positive experiences, and we're all kind of unified behind the idea of preventing what we call bad education, which is just where you're just there for the time rather than the actual quality of the education. So we were very keen to get involved with that. From other opportunities and understanding this through our management and for our practice manager, we looked at the positivity of actually assessing what we do at the moment to see is it in line with what the ULE would offer, which also gives us a way of us assessing what we do to see could we make any improvements going forward. We're aware that the benefits are wider, so for patients as well. So patients have often spoken about the positive interactions they have with trainees and students, often because of the longer conversations they have, being able to demonstrate kind of good listening and being able to really understand a patient and where they've come from. The unified learning environment process is critically important for the future of primary care. We know the GP world and primary care world has changed significantly in the last 10 years, and it's going to change again in the next 10. So we have to be prepared for those changes. We know that there's diversification of the workforce. The way that GPs work, it's just different to what it used to be. And we know about this idea that GPs are becoming much more of a consultant role, so almost like a primary care consultant. We're going to have more situations in which we oversee other teams in order to deliver effective patient healthcare. And my real push here is, why don't we get involved early? If we have a stake in this now, if we're able to invest in our workforce then we'll be able to reap the benefits, and those come in benefits for the practice, for us as educators and as GPs, but also for the trainees and students themselves, who will enjoy a rich and valuable training experience